Good morning, Dr. Mwanzia. Dr. Mwanzia is an academic from Kenya, and Dr. Mwanzia is hold a PhD degree in business administration, and she specialized in enterprise management, and she's a lecturer in a university in Kenya. So this morning, we are going to be speaking to Dr. Mary Mwanzia from Kenya. So Dr. Mary Mwanzia, good morning and welcome to the Bon Bon Show hosted by the Northwest University Business School.
Thank you so very much, Joseph, and the delegates.
Our theme for this morning will be we focus on the COVID-19 on Kenya's economy. So, Dr. Mary, do you prefer me to call you Mary or to call you Dr. Mwanzia?
You can call me any name. I'm okay with any.
Yeah, so please, can you tell me how has COVID-19 affected can you explain to me your idea of COVID-19 and how has it affected the world and individuals and individual countries in different parts of the world?
So now, COVID-19, as you can know, this has really the coronavirus pandemic. It has really affected Kenya, not only Kenya, even Africa and the world at large. Mostly in African countries, you can imagine people are really they're actually poor. Most of them are very poor. And we can see, like in Kenya, 2 million more Kenyans are in poverty because of the closure. It has really affected businesses, economy in Kenya in several ways, whereby so many sectors have been closed: manufacturing sector, eateries, restaurants, hotels, counties were closed. The most vibrant, the economic zones, they were closed. And also we can see they also closed so many people from entering those counties. And we see that in that way, people really were affected. Education sector, yes, it was affected. Even in Africa, it was affected, but all the same, even in the world, they were not able also to ship out. There are things in Europe, yeah. Things were just told, yes.
Thank you, Dr. Mary. Yeah, COVID-19 is a world pandemic and is affecting countries both in a global fashion and in an individual way. Now, may you also tell us the way in which the Kenyan government have been responding to the COVID-19 pandemic in Kenya as we speak?
Thank you so very much, Dr. Joseph. And what we are seeing in Kenya is that the government, the first wave and second, that is what I will talk first on. Because the first wave, the government came in and it cushioned all the people, the people in Kenya who are employed or not employed. Actually, they were giving direct cash. And sometimes the people who are employed, not sometimes, but people who are employed were given tax relief, which is 30%, and we were told not to pay. Secondly, we saw that people also there were a waiver on some products like fuel. It came down actually to, they cut, like, they actually reduced the prices of fuel to off 20%, and that one was really good. And also we saw that the private sector also was a little bit, the president actually opened up a little bit of the businesses, phases. Few businesses were opened, the hotel industry was opened, but given some few hours. Yeah. that the curfew is there, but they were given that allowance of just going to look for something. And people were also told to work at home, the elderly and the most, the people who are actually most prone to this. And also now the third wave is really whereby now the country has been locked. No, there is going in and going out. The international flights are coming in and someone can fly. But now this third wave has really been affecting Kenyans in a big way. People are dying. They were dying before the closure, but now the president had to close down. All now the count is where there's so much of this pandemic spreading like bushfire. And he has actually also brought in the fact that now the pandemic is here, so we have to be immunized. Now people are actually getting the vaccination for COVID. And why I see the president has done that is because the most prone counties, he said that the aged 58 years, the people who are teachers, the nurses, the healthcare and everybody, and the government employees, mostly the police, are on the forefront and they will be immunized. And why he has closed this is because he wants them to be immunized, because they are the people who can actually get this COVID-19 so easily and spread. Yeah.
Okay.
And
Okay, thank you, Dr. Mary.
Thank you.
Yeah, we can see the Kenyan government has introduced several strategies: tax relief, fuel reduction prices, progressive opening of the private sector. And we know Kenya as a country is largely dependent on the tourism. Tourism is one of the biggest sectors in Kenya. So the gradual opening of the economy provided some relief to the Kenyan citizens. But as you said, currently Kenya is experiencing third wave, and the country, the president has responded by closing down certain counties where the spread of the disease is on the rise. Yeah, no, that's very, very good. Those are very good strategies, and those strategies are being applied across the world. But some of them, like tax relief, fuel reduction prices, those are very specific targeted strategies from Kenya. Now, I just want you, given the response with regard to your strategies by the Kenyan government, how have these strategies helped mitigate the impact of this pandemic on the people of Kenya, both at the household level as an individual, at an individual level as well?
So, Doc, what are the government actually, what we are seeing is that after the president mitigates, actually, we are seeing a drop of it. The pandemic was rising when everybody was being, when people were being actually tested for COVID. But now, all of a sudden, when he closes down and people are now getting immunized, then it goes down. The infections really just go down all of a sudden. So we don't understand, but we are seeing that there's some kind of a drop. And actually, when we have also a negativity when he has closed down in this, we are seeing so many people actually without food. Others are really, they do not have financial support. Most of them, because most of the people in Kenya are living below. They earn actually not more than $1 a day. Some of them really are suffering. The businesses have closed, the manufacturing industry have closed, but he has actually opened up a little bit of the manufacturing industry. So most of the people are going home. The small scale farmers, the small scale enterprises have closed down. And we are seeing some of these things because there is the positive part and the negative part. But the beauty is that being immunized, and when we have that lockdown, actually the prevalent, that rise of the pandemic really is going down. How? I don't know. Is it psychology or what?
Yeah, thank you. Yeah, so what you are saying is that Kenya was witnessing increasing infections rate, but due to the strategies that were implemented by the government, you are now witnessing declining infections. And also there's immunization process going on in Kenya, which has led the government to open some of led to partial opening of some of the small businesses in Kenya. In your own opinion, do you think the Kenyan strategy or Kenyan approach can be replicated across Africa as an African solution to a global pandemic?
Yes, Dr. Yes, Doc. What I'm confident of is that African countries, like mostly we have South Africa. South Africa is on a higher note when it comes to economy, and it can do better, even better than Kenya. That whatever strategies we have implemented here, it can be done even in Africa, in South Africa, or in Africa elsewhere, because we have all what it takes. Because we've seen we can actually live without, we can actually manufacture, we can treat people here, people can get treated in the hospitals without even going abroad. We can work at home, even going to the offices very comfortably, unless you are doing the mechanical and actually the practical part. So I totally agree with you that these strategies we have taken in Kenya can also be implemented elsewhere in Africa, and we can be a better continent if we actually trust in ourselves, trust in our minds, trust in whatever we do, because we are better, we can do good.
Yeah, thank you, Dr. Mary. What you are saying
innovation.
is that, yeah, the population of Africa is resilient, despite our poor infrastructure, our poor medical infrastructure, the weak social and economic system in Africa. Africa has managed to weather the storm, particularly Kenya. In South Africa, it's a little bit different, but we think that some of the strategies that you have outlined initially, for example, tax relief, fuel reduction, reduction in the prices of fuel, are very, very good ideas that, if implemented in South Africa, can go a long way to relieve the population from the burden of the COVID-19 pandemic. Any last word from you, Dr. Mary?
My last part is that I want to say thank you so very much for inviting me here. And in Africa, we need to have innovative minds, creative minds. We need to trust in everything we're doing. And people should actually take COVID-19 as a pandemic. We have seen many pandemics in Africa. They have come and gone. So I only ask people to get the vaccinations because it works. Personally, yeah. I've been injected. I'm vaccinated, so I have it. I'll be back on 25th, actually, May. And yeah, don't despise, because lives are being lost. Don't despise on this. Lives are lost. Go and get immunized for those who are really in the front line.
Yeah. Yeah, thank you, Dr. Mary. The message that is coming out from you is that People should accept the vaccine. Everybody should go and get vaccinated so that together we can reach population immunity and together we can control the virus. Thank you for your time, Dr. Mary, and thank you for giving us the Kenyan perspective when it comes to managing the COVID-19 pandemic and the impact of the COVID-19 pandemic on Kenya economy.